All of us agree that good and effective communication forms a major determinant for patient satisfaction. Not just the patient satisfaction, patient safety is also determined by good and effective communication. There are many studies which show that the poor physician patient communication leads to 13% more safety related incidents, whereas the nurse patient communication, when it is poor, it leads to 25% more safety incidents. Let us take the example of medication safety. It is the studies very well tell that around 25% of the patients do not take the medicines which is prescribed by the doctors. What is the reason? Either they do not understand, they don't agree with the medicines, they don't have faith about that medicine, or they are confused about the medicines. If this is the case, how can the medication safety be ensured? Let us take the example of verbal order. Verbal order is commonly given by doctors. Let us take an example where a doctor tells the patient has to be administered 15 units of insulin. Nurse heard it as 50 units of insulin and led to a patient safety incident. Now, if there is a simple technique like read back, checking the spelling, checking the numericals, especially between 13 and 19 and 20s, 30s, and all that, will ensure patient safety. Another important tool for handoff communication or handover communication, which is also known as the Bermuda Triangle of healthcare, is ISBAR. A simple tool like ISBAR, where I stands for identification, identification of the person who is giving the handover and taking the handover, and identification of the patient as well, which has to be a double identification, dual identifier. Then talking about S stands for situation. Situation is the major problem you are having to face with. Then the background about how the patient got admitted, what are the comorbidities. Then the assessment includes the vitals and the current situation of the patient. The most important one is the recommendation, what needs to be done further. This is a good example of an assertive communication which actually saves lives. Other simple tools like closed loop communication, especially during a code blue event or during surgery, where a team needs to be communicated. If the doctor tells so and so is allergic to such drug, if the nurse acknowledges it by telling, closing the loop, that I understood that the patient is allergic to such and such drug, it helps in patient safety.